Hello everyone and welcome to COPD Live. I'm Jake Mossop, a registered nurse and TV personality, and I'm so proud to be here tonight with the Lung Health Foundation, working together to support Canadians living with COPD. I'd like to take a moment to thank our partners, GSK Canada, AstraZeneca Canada, and Trudel Healthcare Solutions for making tonight's event possible. A little bit about me. I've been working as a registered nurse for nearly 18 years and have extensive experience in both the acute and post-acute care hospital sector. Currently, I'm a manager of nursing practice and education at a Toronto complex care and rehabilitation hospital. And over the years, working as a nurse and clinical manager, I've worked closely with clinical staff providing and patients receiving respiratory care and rehabilitation, many of whom are living with COPD. Tonight, we're here to talk about living well with COPD. We know it's a journey with its challenges, but also with plenty of ways to thrive and live fully. We're thrilled to bring together experts, educators, and even a few of our friends directly impacted by COPD to share insights, answer questions, and provide guidance. And remember, this event is for you. If you have questions as we go along, please don't hesitate to drop them in the chat. We have our certified respiratory educators on hand throughout the session, ready to provide support and help answer your questions live. So whether it's about COPD management, resources, or any other topics, we're here for you. We'll also be sharing resources throughout the event, and you'll see QR codes on your screen that you can scan with your mobile device to access directly. Keep an eye out for those. This way you'll have everything you need right at your fingertips, from educational tools to ways to stay connected with us after the event. Our goal tonight is not just to inform, but to create a supportive community space where you feel connected, informed, and empowered. We're here to provide you with practical strategies, answers, and inspiration. Please keep in mind that everything shared during tonight's program is intended for general information only. Always consult with your healthcare professional before following any recommendations discussed here to ensure they're right for your individual needs. Before we dive into tonight's show, Jessica Buckley, CEO and President of the Lung Health Foundation, is going to lead us through the Lung Health Foundation's land acknowledgement.
As an important part of our commitment to reconciliation, we would like to begin by acknowledging that the land on which we stand upon is the traditional territory of the Anishinaabeg, Mississaugas of the New Credit First Nation, the Haudenosaunee, and the Huron-Wendat. This land is now home to many Indigenous nations from across Turtle Island, including the Inuit and the Métis. We acknowledge this land because it is important to remind ourselves that we are working on behalf of all Canadians, including Indigenous people, who have been and continue to be negatively impacted by Canada's colonial history. It is impossible to have valuable conversations about lung health in Canada without connecting these conversations to the harms done to Indigenous communities.
Thank you so much, Jessica, for grounding us in that. I know that COPD and lung health is at the core of LHF's mission, and I'm excited to talk about the incredible work you're doing here. So to start off, tell us about how has the Lung Health Foundation been working to support Canadians in terms of their COPD, but also particularly in improving their day-to-day quality life?
Well, the Lung Health Foundation provides a lot of resources and materials to help people manage their symptoms. So people that are living with COPD, sometimes they get diagnosed and they are at a loss of, where do I go next?
Right.
And how do I learn about this? So we provide those materials, and we also provide programs, things like Fitness for Breath, another program that we have that's a one-on-one coaching program called My Lung Health Coach.
Oh, okay. And I think later today we're also talking to someone from the Loop.
Yes,
Yeah.
exactly. We're going to hear more about the Loop.
Yeah, so many exciting things. Okay, so tell us when you got started with Lung Health Foundation, how do you decide and implement which programs to have?
Well, we really look at the gaps that are existing across the system. Unfortunately, the history of lung health in this country is that there's been so much stigma associated with lung disease in general. And that has to stop. And therefore, as a result, a lot of programs have not been as well funded as they could have been through the years. So we really look to see where those gaps are and how we can support people that are living with lung disease today and how they can live their best lives with a chronic disease.
And I think that key word is living, and I think a theme for tonight is living well. So what does it mean to live well with COPD?
So living well with COPD is really being able to manage your symptoms so that you can carry out your everyday life. And our programs, things like Fitness for Breath, really do help support that. Where you know, are able to have the stamina to do things like getting your groceries and getting up the stairs and having the energy to, you know, sit through a long family meal and things like that.
Those basic activities of daily
Exactly.
living. Yeah.
Yeah.
And so you've touched on a few already, but what are some of the key initiatives or the programs that you're excited to share?
Well, the My Lung Health Coach has been a very important program for us. We piloted it this past year.
Okay.
It is a one-on-one coaching program, and it's with a certified respiratory educator. So someone that really understands lung disease and understands what you're going through. So it's a 12-week program, and they cover things one-on-one with the person living with COPD about managing your medication and what types of activities you could be doing to help with your lung disease, and just being that overall support that people need.
And how do they access the certified respiratory educator? Is it virtual? Is it in person, or a combination of both?
Yeah, great question. It is virtual,
Okay.
so we can deliver that program to people that may be living in a remote area, which is very important. And having access to our programs is something that's important to us. So we do a lot of our programs virtually.
Okay, so speaking of distance and accessibility,
Yes.
what are some of the biggest challenges you find with LHF and the programs that it creates and offers to the public?
Well, we are a national charity, and serving all of Canada does take a lot of funds to be able to expand our programs and have enough staff to be able to bring the program to more people. With the virtual format, we can reach people across the province and beyond, but being able to fund those programs is so important.
Yeah, and so not only just for, individuals living with COPD, we often talk about caregivers and family members and the important role that they play. Can you speak to how they can get involved and what supports that LHF offers to them?
Yeah, so having a caregiver is so key. And we have developed something called The Loop. And The Loop is a network for both people that are living with lung disease and their caregiver and family. And it's it's a place online where they can come to connect. They can sign up and connect with others that are also living with lung disease or caring for those that are living with lung disease. And there's resources there, and there's opportunities for them to speak to people that understand what they're going through. So The Loop is a new initiative that we've launched this year that we're very excited about.
Sounds like a really great one where there's potential for mentorship and even just education for these caregivers.
Exactly, education and also that peer-to-peer support.
Looking ahead, what are some of the key innovations or the things that you're excited about that are coming down the pipeline with LHF?
So I've already mentioned The Loop, which we're very excited that launched just a few months ago. We're also excited about a partnership that we have with West Park Hospital. It's a portal that is an online portal where people can go and put in their postal code and determine if there's a pulmonary rehab service offered close to them.
Oh, wow.
And so it's a great online resource that's never existed before. So just getting that information out to the public is very important. The expansion, we hope, of My Lung Health Coach, which is a very impactful one-on-one program. And we also have been working hard on our advocacy as well. So we formed a few years ago the National Lung Health Alliance, and that's joining together with other provinces across the country and like-minded lung health organizations. And we go speak to government, all levels of government, about what is needed to address the fact that lung health has been underfunded. It's often overlooked. And these are the things we need to do to make sure, A, we're preventing lung disease, number one, and number two, that we're getting the diagnosis and care for others.
Right. And so that diagnosis piece is key, right? You have an individual who's getting diagnosed for the first time. What message could you share? What key piece of information could you share with someone who's newly diagnosed with COPD?
So a chronic disease diagnosis can be overwhelming and a little bit scary, and we are here to help. So the Lung Health Foundation has a really wonderful team of people that understand. They're certified respiratory educators. They're people that have, committed to this mission of helping others living with lung disease. So we are here with resources, with one-on-one counseling, and to connect you with others that are going through what you're going through.
And I'm so excited because we're going to meet a lot of those team members tonight.
Yes,
yeah, and talk
exactly.
to them about what they're doing, the education they're offering, the programs that they're involved with. So I'm really excited to meet them and talk to them.
Great.
Yeah. So in terms of the public, right? We're here, we're broadcasting live. How can the public get involved? We speak a lot about the funding and it being underfunded. So what are some of the key ways general public who might not be so connected to COPD, how could they get involved?
So we are a national charity, and all charities in 2024 and beyond, giving is down. Individual giving is down, and it's understandable. Everyone's household costs have increased. However, these charities, and the Lung Health Foundation being one of them, are filling a gap in the system that when people get diagnosed, it's sort of, here's your medication and, see you in 6 months. And that, well, now what do I do scenario. This is where the programs come in, and we help fill that gap in the system for people that are, scared and vulnerable and need help to be able to manage their chronic disease. So being able to find some money to help donate is certainly welcome. We do rely on the generosity of donors to help these programs continue and also to grow and expand.
Yeah, I think that's so important for people to know because, like you said, there is a gap in terms of what is being offered by, say, like a hospital. And so beyond that, when you're back in the community, the Lung Health Foundation is where people are going to get that support that they need.
Right.
Yeah.
Yes.
Yeah. Well, thank you so much for joining us and sharing your thoughts and insights. And I'm excited to meet the rest of your team and the people that we have to speak with tonight.
Thank you, Jake. It's been great. Thank you.
We're so glad to have you with us for this special event. At the Lung Health Foundation, we rely on the generosity of supporters like you to make programs like tonight's COPD Live possible. Please consider making a gift through lunghealth.ca/donate or by scanning the QR code on your screen. Your contribution will allow us to continue raising awareness and providing support for Canadians impacted by COPD. We are now joined by two experts from the Sing Well Project, which uses group singing to improve lung health. Dr. Frank Russo is a professor of psychology at the Toronto Metropolitan University and a leading researcher in auditory cognitive neuroscience. He brings deep expertise in how singing impacts lung health and overall wellness. Dr. Arla Good is an adjunct faculty member of Toronto Metropolitan University and co-director of the Sing Well Project. She focuses on how group singing can improve psychological well-being and health, especially for older adults. We're excited to hear how singing can strengthen lungs and foster community connection. Welcome, Dr. Russo and Dr. Good. First of all, Dr. Good, do you get commented a lot about your last name?
I mean, this is why I did a PhD.
Okay, yeah, the whole reason behind it. I love it. So let's start off with lung health. So how does singing impact lung function and respiratory health?
I mean, the beautiful thing about singing is it's baked in with what we're doing, right? There's like the deep inhalation and the long controlled exhalation. It's basically mirroring what we do in pulmonary rehab, except it's a lot more fun.
Right, yeah.
Yeah, a number of things to say, but the fun part is critical. Like we know that making music, listening to music that is important to us actually activates the reward system in the brain, which means it's something that we'll want to keep doing. It's some lung health exercises can be monotonous and they're important, but singing is a great complement because it's just easier to do because of that fun component, especially when you do it as a group.
So speaking of fun, what was the motivation behind Sing Well Project and how does it cater and help people who have lung health challenges?
The motivation around Sing Well was that we know that group music making brings people together. It allows them to feel connected. Yeah. One of the things that happens when we're suffering from a lung disease is we can isolate ourselves. Because of this shortness of breath, we're less likely to accept that invitation to a party. I could go, but it's not really critical. And these things accumulate. And there's all kinds of sequelae that could come from that, depression, cognitive decline, etc. So, given that singing allows people to feel connected, and we have some evidence that it strengthens the respiratory system, why not put these things together and track the whole psychosocial, physiological endocrine changes that happen when we sing as a group. And that's what we're doing. We're actively setting up singing groups around Canada in particular, and we're tracking these benefits and developing a body of evidence.
Right. Dr. Good, what about people who do have respiratory illnesses? Do they often feel like they can be included in singing, or speak to us about that?
So there's an interesting phenomenon of people who, especially older adults and those living with communication challenges like lung disease, that they feel singing's not for me. I can't sing necessarily because of my lung disease.
Yeah.
And so the hardest part is getting people through the door. And once they're there, they realize, it's not always about the performance. Like, not everyone can be a Whitney Houston.
Right. Not me.
But there are benefits. If you show up and participate, there are benefits for everyone. And so we just want to get people through the door and show them that there's a lot that they can grow when they're participating in singing. And the community building, as Frank mentioned, that, some of the feedback we're getting is, I'm around people who have the same challenges as I do. When you need to cough, you can cough freely. Like, if you can't sing, just try. And you're still there, you're using your lungs. And so there's a lot to be gained just by showing up and walking through the door.
So that's some of the psychosocial. Let's talk about the physiological. What are some of the physiological changes that are happening in our lungs when we're singing, and what are the benefits?
If you think about what happens when we sing, we normally sing over a number of bars of music, and typically we're inhaling and then we sing all the notes through the exhalation. So what this provides is an opportunity for deep inhalation, controlled exhalation, and we slow down the breathing. It becomes deeper breathing. It activates the parasympathetic nervous system, which reduces cortisol. We've tracked that. We know that singing reduces cortisol, which is the stress hormone. So there's a number of physiological changes. This drop in cortisol, this controlled breathing, that if we practice over time, is actually going to strengthen those muscles that support inhalation, exhalation, especially when we're singing loudly and we're challenging ourselves. That's what a lot of our choir directors say is, I don't care what you sound like, I don't care if you think you sound awful, I want to hear you. And that's exactly what we need to be doing to exercise those muscles that support lung health.
So let's pivot a little bit and talk about specifically COPD. So what are some of the unique benefits that you've seen for individuals who are living with COPD?
So, the evidence is encouraging when it comes to lung function and singing. We've seen some improvements on peak expiratory flow and a self-reported decrease in shortness of breath. So people leave after a singing session feeling less shortness of breath.
Okay. So what are some of your current research goals when it comes to singing and using singing as a therapeutic tool?
We've just launched a new singing group up in Midland, Ontario in Canada, and it's social prescription. So this is the doctors, the lung specialists, they're referring their clients to the group singing. And so one thing that we'd like to do is be collecting the evidence to show not only does it help support lung function, well-being, but it also makes economic sense. So we're running these economic cost-benefit analyses so that we can advocate and convince decision makers that this should be part of the model of healthcare.
And how do we educate providers? Because I'm sure there's a process now of telling providers that this is a tool that can be used as a therapeutic tool.
It's an ongoing process. So segments like this are great. We have organized a speaker series where we're trying to distill what we know and make it readily digestible. And that's what I see ahead of us, that a lot of education about the opportunity, the fun of singing, that this doesn't get in the way of other things. It's a value add, and it's something that your patients are probably going to enjoy. It's not like pulling teeth. So.
Yeah. And so what are some of the other community-based resources that are provided by Singwell?
So Singwell is developing a map on our website where we are trying to track all of the different singing groups across Canada that are supporting people living with communication challenges like COPD. So if you go to the website and you check out the map, you can find the nearest choir or singing group that is supporting your communication challenge. This is a tool also that can be used by practitioners, doctors, that if they do want to refer their clients, here's a way that they can find what's closest to them. Some of these choirs are online, and this allows people across Canada to join the same choir. We have one, it's called the Better Breathing Choir. Okay. It's housed in Newfoundland, wow. And yet there's people participating all the way in BC. Oh. So people are joining in from all over the world.
Yeah, that virtual aspect.
All have lung disease, wow. And they show up and they sing together every week.
And so one final very important question, how do these singing groups come up with their band names? Is this the process? Do they need to vote?
Yeah, no, that's happened. That's happened a little bit. It's the choir leader is usually, I know this is a tongue-in-cheek question, but the choir leader, gets a sense of what people like.
We like to explore what I call choir in its natural habitat. So we don't try and come in and tell them what to do so much. We provide them with resources so they can best do their job. So when it comes to naming the choir, we leave it up to them.
Exactly. Yeah. Well, thank you both so much for coming and sharing the positive impact that singing's having on individuals living with lung health. And thank you so much for talking to us about the Sing Well Project.
Our pleasure. So much for having us. Yeah.
Be a part of the 42nd Annual Better Breathing Week Conference, January 21st to 22nd virtually and January 24th to 25th in person at the Intercontinental Centre in Toronto. Don't miss the opportunity to dive into lung health advancements and learn from leading experts across education, policy, and research. Tickets are available now at lunghealth.ca. Our next guest is Dr. Sasha Binder, a leading adult respirologist based in Toronto, practicing at Scarborough Health Network, Toronto Lung Care Clinic, and the Heart Health Institute. Alongside his clinical work, Dr. Binder is a lecturer at the University of Toronto and has held significant leadership roles at Scarborough Health Network, including corporate chief for the Department of Medicine. Today, he'll be here to discuss the Aerobica device and its role in improving comfort and independence for COPD patients. Welcome, Dr. Binder.
Thank you for having me.
Yeah, let's start off with what is the Aerobica device and how does it work to help people who are living with COPD?
That's a great question. So the Aerobica device is a device that revolves around the principle of oscillating positive expiratory pressure. That's a mouthful.
Yes.
But essentially, it's a device that generates pressure that fluctuates such that when a patient takes a big breath in through the device and they start exhaling through it, the airflow out of the lungs will start and stop. I think of it and describe it to patients actually as mechanical chest physiotherapy. Most of our patients with COPD, unfortunately, are afflicted by a high burden of mucus. Their airways are damaged and they produce a high level of secretions. If you think of a river, a smooth flowing river doesn't pull stuff in from the banks, but a turbulent river will do the same thing, pull stuff in from the banks. The oscillating positive expiratory pressure of Aerobica allows that patient, when they're exhaling, to have that start and stop of airflow to pull mucus, to send vibrations through the airways, through the lung, to shake mucus loose and allow it to flow. They may not feel that all of a sudden there's a big ball of mucus that comes out, because the airways have a natural mechanism of clearing those secretions. But sometimes when the sputum and mucus is thick and stuck, it's difficult for it to move, and it just needs something to get it going.
Okay, so how often would someone use that in a day? And how often would they be using it?
It depends. It depends. I generally instruct patients to use it 3 times a day. 10 minutes in the morning, 10 minutes at night, and 10 minutes in the afternoon. During the day, as we're sitting up right now, gravity will keep secretions near the base of the lung. Most patients will say that when they lie down at night, within the first 10-15 minutes, they notice secretions, they have to cough and clear their throat. Well, that mucus was already there. It's just that by lying down, gravity is no longer keeping it at the bottom of the lungs. Very helpful to use this for 10 minutes before bed. Clear those secretions, actually get better quality sleep, feel better. The person beside you may not be disturbed by cough and mucus. So overnight, we actually don't move as much air throughout the chest. So mucus accumulates over the course of the night. And patients will experience cough and mucus when they wake up in the morning. 10 minutes in the morning addresses that, leads to a good morning. And for those with a higher burden of mucus, let's say, for example, in the afternoon, if they're going to have a social event and they don't want to have cough or sputum, they can use it before the event in the afternoon, clear the chest for that afternoon.
So improving airway clearance is obviously important, and Aerobica helps with that. So how does this help patients live more comfortably? You already said in the morning you can use it and help. So how is it impacting and helping them live well?
That's a great question. One of the challenges of respiratory medicine is that we often forget how the patient came to us in the first place. They have shortness of breath, often insidious, cough, mucus, chest congestion. But fundamentally, something happens where they can't do something, or a symptom is interfering with their daily life. They bring that to the attention of their primary care practitioner. They have pulmonary function testing, they have a diagnosis of COPD, They're started on inhaler therapy, they're referred to a respirologist. Most of what I do in terms of prescribing inhalers, antibiotics, and other medications is to slow the rate of decline, prevent chest infections. But most inhalers don't fundamentally address what was the first problem that they had, the cough and sputum.
Right.
Mechanical chest physiotherapy with aerobica allows us to target that. And for most patients, the inhaler therapy prevents chest infections, keeps them out of hospital, prevents the need for antibiotic and prednisone. But the daily morbidity, the suffering that they have with cough and sputum, inhalers don't effectively address that, as well as they prevent chest infections. Now we have a device that patients can readily use in the comfort of their own home to manage the symptom that was the start of this entire journey.
Right. So they have their symptoms, they go see their family doctor, they get to see you, a specialist. What feedback are you receiving from patients who are using aerobica at home to help them with their COPD?
Patients love it.
They love it.
Patients love it. And playing on that last point I made about finally addressing what there was their main symptom when they started this journey, patients find that it gives them freedom and independence from cough and sputum.
Wow.
It's not uncommon that I will describe to patients the burden of cough and sputum, and I'll say things and they'll be nodding along that you're sitting watching television, not talking to anyone for a couple of hours. All of a sudden someone calls you, you pick up the phone, and within a few minutes you have to cough and clear your chest. You start engaging in a conversation with someone in your home, and within a couple of minutes you have to cough and clear your chest. You try to go for a walk, start moving more air through the chest as you exert yourself, and same symptom occurs. You can decrease the frequency, severity, and intensity of those symptoms, and in some cases eliminate it.
Wow.
And the beauty of the device is that if you have a higher burden of symptoms, you can increase the frequency of use of the device to clear it.
That's great to know where it can go. So where can people get it?
Great. Any pharmacy. It does not require a prescription. If you do have private insurance, most private insurance plans will cover it. Everyone has to inquire with their plan, so a prescription will be helpful in that case. But for many of my patients who do not have private coverage, they can go to any pharmacy. It is not necessarily in front of the counter. So you'd often have to ask the pharmacist. Usually they'll have it in inventory. But if they don't have it, a couple of days, they'll be able to acquire it.
Thank you, Dr. Binder, for shedding light on how innovative tools like the aerobica device can help people with COPD manage their symptoms and improve daily comfort. We hope this conversation inspires anyone affected by COPD to explore resources and advancements that could make a difference in their journey to better respiratory health. We'd like to thank our partners and sponsors GSK Canada, AstraZeneca Canada, and Trudel Healthcare Solutions for making tonight's event possible. Thank you for your continued support and work in COPD care for Canadians. Next, we're joined by Sonia Cardozo, a registered respiratory therapist and certified respiratory educator with the Lung Health Foundation, who specializes in helping patients manage chronic conditions like COPD. With her expertise, Sonia will discuss the critical link between sleep and COPD, how poor sleep can worsen symptoms, and practical strategies for improving sleep hygiene. She'll also share valuable tips for caregivers and highlight what to watch out for if someone with COPD is also dealing with sleep apnea. Sonia, so great to have you here. Nice to meet you.
Nice to meet you, Jay.
And you just celebrated RT Week.
Yes, yay RTs.
So let's get started and talk about how sleep can impact those who are managing COPD at home, and how does the condition affect sleep?
Absolutely. So as we know, sleep is important for everybody, but it's especially important for people living with COPD. When we sleep, it's our body's time to rest, repair, and really restore your energies for the next day. So people who are living with COPD, they often have nighttime coughing, shortness of breath, wheezing, and they also experience frequent drops in their oxygen levels. And what that does is it kind of sends the body into almost like a fight or flight response, leading them to wake up constantly throughout the night. So obviously having these two things occur, it really impacts their sleep. And what it does is in turn can affect their physical and mental well-being.
And is it the same? Because I know we're always told as adults that we need 7 to 9 hours of sleep. Is that the same?
Absolutely. I mean, it's very specific to the person, but that's usually the goal. 7 to 9 is really the aim where you're going to be getting the most out of your sleep.
And so say we're not getting those hours, or we're having a disruptive sleep. How can that worsen COPD symptoms for folks who are living with COPD?
Oh, of course. So poor poor sleep really leads to two main things that affects this type of population. So the first one is fatigue. Fatigue is already a symptom that people living with COPD deal with on a daily basis, but it especially gets worse when they're not sleeping properly. And then what that does is it kind of leads into this really negative, vicious cycle of fatigue, inactivity, and then a lesser way of managing their symptoms the next day, potentially leading to a flare-up. And then the other way is weakening their immune system. So as we know, even for everybody, sleep is so important for restoring our immunity. And when they're not sleeping properly, that's really compromised, leading them to be more susceptible to infections, which I'm sure, as you know, is one of the leading causes of a flare-up. So of course, in turn, when you are getting that good quality sleep, you're really able to recover better, reduce inflammation, and you can also just better manage your symptoms. So simply put, sleep is just that natural therapy that we all need.
And this is why you're an educator, because you make it so easy to understand.
Thank you. I really do try. It's been a passion of mine for most of my career, so I'm so glad.
So let's move into strategies, right? Because if this is what the negative outcomes can be, what are some strategies that people can use to get a better night's sleep and improve their symptoms?
Of course. So, I mean, there's so many. I'm sure we all know and have heard of so many different tips and tricks, but especially for people living with COPD, there's a few that come to mind. So first, elevate. Elevating their upper body. So even, putting a few pillows underneath your pillow, using a wedge, keeping your upper body slightly at an incline is really going to reduce the risk of coughing. And it's also going to help you to expand your lungs a lot easier and reduce shortness of breath. Consistent sleep schedule. So this is something that I'm even guilty of, being in sleep. But really, it is such an important factor in regulating your internal biological clock, going to bed at the same time and waking up at the same time. This is going to make a huge difference in just really regulating that. So usually we say 2 to 3 hours before bed, avoiding heavy meals, avoiding alcohol, avoiding caffeine, but also even just your room environment, keeping it dark, keeping it well ventilated and cool. There's such small things that make a really huge impact on your sleep quality.
So you touched on environment. What can caregivers do to help people with managing their sleep environment, and how does that play a role in people with COPD and getting a good night's sleep?
Absolutely. I mean, so caregivers are so important. I think all of us, and probably even some of our viewers, have experienced being a caregiver at one point in their life. I know I have. And although the person living with COPD is truly the main driver in their whole management of their condition, the caregivers really keep that tempo, and they play that instrumental role in support. So all of those strategies I just talked about, positively enforcing them, reminding them, encouraging them, and even partaking in it with them is going to make a world of difference. So helping them set up their bed, helping them to remind them to take their maintenance puffers and their supplemental oxygen if they've been prescribed that. Even helping them, remind them to do their breathing exercises and some of the coughing techniques that we'll talk about. That is all going to play a huge role in helping them manage and just, share the load in dealing with their condition.
So if there's two people and they like different sleeping temperatures, who gets priority?
Caregiver
or the person living with COPD?
I'm going to have to go with the person living with COPD. I'm sorry, but there are lots of ways to have different sleeping temperatures and managing that, but the person with COPD, they get that.
Now, what are some exercises or techniques that folks with COPD can do before bed to help alleviate some of their symptoms to encourage a good night's sleep?
Absolutely. So there's a few that come to mind, and I'm sure our audience has probably heard of these, but we'll quickly go through them because I think they're so wonderful. So there's 4 that come to mind. So pursed lip breathing, forced expiratory technique, deep breathing or diaphragmatic breathing, and controlled cough. So we'll start with pursed lip breathing. This is probably the most common one, but I've heard has made such a huge difference.
Okay, teach me as if I was someone who needed to learn it for the first time.
Absolutely. So pursed lip breathing, what's special about this is obviously pursed lips, okay? So I'll demonstrate. Yep, pursing your lips, as if you're blowing out a candle or if you are whistling. That pursed lip, what that does is creates resistance when you're exhaling. So we say for this technique, you're going to use a 2 to 4 ratio if possible. So breathing in through your nose for 2, and then exhaling through pursed lips, perfect, for about 4 counts. But really it's that prolonged exhalation that we're going for, because that's gonna really help to get rid of any stale or trapped air in the lungs. And using that little bit of resistance is gonna help with that to keep them open. The other one is deep breathing. So this is very simple, but it involves concentration. And sometimes I even just use my hands on my lower abdomen, because I think so much of us, we tend, even throughout the day, we breathe really superficially.
Right.
But trying to breathe with your stomach and feeling your hands go up and down is a great tactile cue to know that you're getting deep breaths. And what that does is it helps air to get behind those secretions and mucus, so then they're easier to clear.
Right.
The third one is forced expiratory technique. So that is going to be, so what's special about this one is using something called a huff. Okay, so a huff is a forced short burst exhalation with the glottis open. So I'll show you. Usually keeping your mouth like kind of in an O shape. So I'll demonstrate. Yes, perfect. So doing that a few times, what that does is it helps to get air behind the secretions, which we've talked about, and mobilize the secretions.
Like break them up.
Break them up and bring them into the lower airways so that they're easier to expel. So doing the huff a few times is really going to help with that. And then last but not least is actually clearing the mucus, the controlled cough. So the reason why we say controlled is because it's a really effective way of utilizing their energy for coughs, as opposed to doing many smaller ineffective coughs. And the whole point of it being controlled is you're using just enough force to get the secretions out, but then not enough that it's collapsing the airways. So to do this technique is pretty much just a little bit of a process. Usually we recommend doing a little bit of that diaphragmatic or deep breathing that we talked about, holding your breath for 2 seconds. And then I can demonstrate again 2 sequential coughs. So kind of like,
and I love that you coughed into your elbow.
I mean, very important technique. But the first cough is going to really mobilize secretions, and then the second one's going to clear it. And then if, we always say though, if they've done it a few times and it's not working, conservation of energy is really important for this population. So we say just stop and try again later. But doing these before bed are really going to just help them to breathe better, clear their mucus, and get a good night's sleep.
Wow. Thank you.
Yeah.
And so what about, we're going to change it a little bit and talk about sleep apnea, because I know this is often something that can go hand in hand with COPD, obviously impacts sleep. So if someone is living with COPD and they have sleep apnea, what are some ways that they can challenge or address both challenges?
Of course. So, already we talked about previous, people living with COPD deal with drops in their oxygen levels. Now, if they have sleep apnea as well, and sometimes if you have both, it's referred to as overlap syndrome. What sleep apnea is, it's repeated obstructions in the airways, which actually block air and therefore oxygen getting into the body. So if somebody living with COPD also has sleep apnea and they're not aware of that, that of course can lead to really a huge heightened risk for even more heart issues as well as lung issues. So I always recommend, talking to your healthcare provider if you're having any types of thoughts that this might be something that's going on.
And so are nocturnal devices like CPAP or BiPAP an option for people with COPD?
Absolutely. So what I would recommend is if you are feeling like, you're waking up frequently throughout the night, you're having a choking sensation, you're snoring loudly, or just really feeling extremely tired throughout the day, talking to your healthcare provider about, assessing your sleep patterns and potentially going for a sleep study is going to be the best way to really know if they have sleep apnea as well. But absolutely, if they've been diagnosed with sleep apnea, the treatment is called a CPAP device, or positive airway pressure device. And what that does is, of course, it's just essentially a fancy way of saying a fast pressurized air going into the airways to keep them open and just really encourage that oxygenation in their body. So all of those things are really important that they're discussing with their healthcare providers.
So Sonia, at what point can either a caregiver or an individual know that it's time to seek out help from their healthcare professional? When should they go?
Absolutely. So, similar to some of the symptoms I just said, like if they notice that, Another thing that makes a huge difference as well is if they have any change in their medication. So I know oftentimes if they've got a flare-up, they sometimes are prescribed a different medication than what they're currently on. And what a lot of people sometimes forget is bronchodilators, which are often prescribed for people living with COPD. Some of the side effects, especially the long-acting ones, are not insomnia, and even some steroids that can really impact the sleep-wake cycle. So any changes, new and recent changes in the medication, and they're noticing that their sleep is a lot more disturbed. Like I said, frequent awakenings, feeling really tired the next day.
Heavy snoring.
Heavy snoring, absolutely, that's the biggest one. All of those just mean, it doesn't mean that you have sleep apnea, but it means you should have a sleep study to really know, because if you don't, you have no idea what's going on when you're sleeping.
Agreed. Well, thank you so much, Sonia. This has been such valuable insight, and I've even learned a few things. So thank you for talking to us about the connection between sleep and COPD.
Absolutely. Thank you so much, Jake.
Thank you. We're so glad to have you with us for this special event. At the Lung Health Foundation, we rely on the generosity of supporters like you to make programs like tonight's COPD Live possible. Please consider making a gift through lunghealth.ca/donate or by scanning the QR code on your screen. Your contribution will allow us to continue raising awareness and providing support for Canadians impacted by COPD. We'd like to welcome our next guests, Scott and Wendy, who we are thrilled to have with us tonight. We will hear from Scott on how COPD has changed his daily life and the steps he's taken to stay active, including continuing to play golf. And Wendy, Scott's caregiver, is here to share the challenges she's faced and how they both managed to maintain a good quality of life together. Let's dive right in. Hello, Scott and Wendy, how are you?
I'm well, how are you?
Good, thanks. Scott.
Fine, thanks.
Yeah, you're good? All right,
Yes.
I'm gonna start with you, Scott.
Right.
How has COPD changed your daily life, and what steps have you taken to live well with your diagnosis?
Daily life is a strain, really, really difficult, because you have to think about what you're doing every day when you get up, and you have to plan that day. You just don't get up like more normal people and start doing stuff and run away and get things done, because it just doesn't work that way.
It takes more thought.
Absolutely. It's harder to breathe, therefore you have to plan that part.
Yeah.
Even talking it is very difficult sometimes. But other than that, it's dealing with the people that deal with you.
Wendy, okay, so what have been some strategies as a caregiver that you have implemented to help Scott and yourself live well with his diagnosis of COPD?
Well, I don't consider myself a caregiver as much as a support system.
Okay.
So some strategies I've implemented is taking over as much of the physical labor of owning a house as I can, such as, shoveling snow.
Leaves.
The leaves, just did that.
Yeah.
Yeah, just things like that. All the little errands, if he needs something from upstairs, I'll run up and get it, or just small things like that.
Yeah, so those like activities of daily living that we often don't think about can be a little bit more challenging.
Yes.
Yeah. And how has the support been for you, having a live-in support?
It's amazing. She won't let me do anything. It's very difficult though, because when you're used to being able to do that once upon a time in your life, it's a real struggle not doing it. Watching her shovel the driveway kills me.
Yeah, that can be hard. Yeah. Yeah. And so how do you find the two of you? Because you're a partnership, right? And so there has to be those positive moments. And how have you worked together to build and work off of that partnership to have balance?
Well, I suppose the balance is just we've been together for a long time, and then you have to know each other, and I have to know his limitations, and then step up to the plate. The biggest challenge that I've seen is, watching a virile, active man not be able to do what he used to do.
And so I hear you're an avid golfer, Scott. We talked about
not bad.
It. Yeah.
The club that I belong to, Trillium Wood in Belleville, they help me out a great deal. They have a disability function on their GPS, and I get to drive up really close to the greens.
Okay.
So it helps out. And the three other gentlemen, Greg, and Jim, that I golf with, they're amazing. Like, if I don't feel like doing the rest of the hole, they'll find my ball, or they pick my ball up, or just stuff that it takes too much energy for me.
Right.
So they're very good in that respect. No, the 73, I did it fair, so that's
No
okay.
help. Thank you so much, Scott and Wendy, for sharing your powerful story with us today. Your insights into living with COPD and supporting each other through the challenges are truly inspiring. Thank you again for being here and for all the wisdom you've shared. We're so glad to have you with us for this special event. At the Lung Health Foundation, we rely on the generosity of supporters like you to make programs like tonight's COPD Live possible. Please consider making a gift through lunghealth.ca/donate or by scanning the QR code on your screen. Your contribution will allow us to continue raising awareness and providing support for Canadians impacted by COPD. I'm thrilled to welcome Marissa Oliveros, who's here to talk about something truly special. She's the leader of community programs and partnerships at the Lung Health Foundation, who will introduce us to The Loop. This is a powerful network designed to connect, support, and empower individuals living with COPD and all lung conditions. Marissa, we're so excited to have you here and to learn and hear more about The Loop. So tell us, what is The Loop and how did it come to be about at LHF?
Yeah. Well, I'm so happy to be here, and absolutely. So The Loop is the Lung Health Foundation's first ever person-centered online community created by and for people living with lung conditions, as well as their caregivers and their family members, their loved ones, as well as the general public who's just passionate about making an impact in the lung health space.
Wow, okay.
Yeah, and so what inspired us? So the Lung Health Foundation is the leading organization in this space. And for a long time, we've come to the realization that there's a gap in this space, and we needed to be innovative. Based on what we've heard from people that have come to our programs, that have used our services, they really are looking for a community, but not just that community that is virtual, but one that really understands their needs, that can provide them with the resources, the programming, and the connection. So that's the piece that's so important. They want to be understood, they want to be heard, and they want to be seen. And so The Loop is such an inspiring space because it meets all of that as it was really created with them at the top of mind. Yeah.
Right. And so how does The Loop help folks manage their COPD, and also how does it help them improve their quality of life?
The beauty of it is that at its core, its true essence is building that community and creating it based on what they've been telling us that they've needed all these years. So meeting their needs. Yeah. And, the research does suggest that in order to be able to cope, to be able to really better self-manage your condition, it's so crucial that you have a supporting community behind you.
Yeah, people who are going through the same thing.
Yeah,
right?
exactly. Yeah. And supporting not only them, but their caregivers, right? And so with this, we know that as we've relied heavily on the evidence and the lived experience, we know that it's going to be impacting and inspiring, and it's going to energize this community and empower them to make a change and to take charge in their health choices and overall outcomes.
So let's talk a little bit about what are the resources or some of the tools or even expert guidance that people are getting, because I'm assuming on a community-based program there's probably mentorship or they have access to you. So what are some of those specific things that they're going to get out of The Loop?
Yeah, so the beauty of it is that not only is it a community where they get to connect with other people, but it also offers free access in one place to all of our programs and services. Wow. So things like Fitness for Breath, a very reputable program here at the Lung Health Foundation. Yeah. My Lung Health Coach, a program specifically designed for people with COPD. We have our support groups. We have, one-on-one support with our certified respiratory educators who are, very much equipped to be able to.
Just met.
Yeah. Yeah, all of them are not only very knowledgeable, but they're compassionate, they're empathetic, and they really care about making an impact in their life and helping them achieve whatever it is that they're looking for and wherever they're at in their journey of COPD.
Yeah. Marissa, can you share some examples of how people have benefited from joining a community like The Loop?
Absolutely. So in my role, the beauty of it is, and also the really the privilege that I want to say up front is that I get to be one of those front-facing people that they come to first when they're reaching out to the Lung Health Foundation, and they put a lot of trust in me. They're vulnerable, they share their experiences with me, and so I want to thank them before I go and share what they've shared with me.
Fair, yeah.
So really, I think it's important to understand first that the challenges of living with COPD can put a lot of emotional stress on a person, not only physical as a result of the complications of a diagnosis like COPD, but also dealing with the isolation, no longer being able to take part in things that they used to before, or not being able to go to things in person because they're now homebound.
Yeah.
So what they've come and told me over the years I've been here is that being able to have this programming available, for example, Fitness for Breath, has allowed them to, for instance, exercise in a safe and comfortable way where they're able to be themselves. They don't have to impress. They don't have to lose energy in traveling. And that is so important because it really helps with their overall outcome and well-being.
Yeah, self-esteem boost.
Yeah,
right? Confidence.
and the quality of life outcomes of it, right? They're getting the best out of the exercise from just, being able to take part in something at the comfort of their home. They've told me that a lot of them, part of being diagnosed with COPD means that you're encountering a lot of anxiety, and that's part of living with an unknown of what's going to happen. But being able to be with people who understand you, who accept you, who do not judge you, can be very empowering too, and give you hope, give you, joy and a sense of purpose. And that's what a lot of them have told me that they found by being involved in our programming and in our community.
Yeah, I think that's been a common theme tonight is, that sense of community or people feeling isolated. So how do people who are a part of the loop or who want to get involved with the loop, where do they find information? How are they informed? Where can they go?
Yeah, so registration or joining the loop is very easy. We have that in mind during the whole creation process of it, as we involve people during focus groups to inform us what they would want to see. And so what we've done is we've straight up just put it on our website where they can join the loop. If they can't do that because, technical issues always happen, and we're talking about a population that, oftentimes run into these technical issues.
Yeah, issues with technology.
They have one-on-one support offered through me.
Okay,
so as the community navigator, that is one of the things that I have to offer. And it's a great opportunity because I get to not only help them join, but I also get to inform them on all the things that are available to them. And while you're part of it, there's also really good opportunities. So we have our newsletter.
Awesome.
And in this monthly newsletter, you get to receive updates of what's going on.
And what about caregivers and family members? Because we know they're so important to individuals who are living with COPD. How can they get involved, and what guidance or benefits can they get from the loop?
One of the most important things that we acknowledge is that caregivers are oftentimes kind of left behind or not put at the forefront, but they are still very much important in the process of care, in the journey of managing COPD, and they also have to face different challenges. So like isolation, burnout.
Yeah,
we know that that's a really big concern when it comes to caregivers. And so with that in mind, we've designed parts of the loop to just be dedicated for them.
Wow, okay.
The support groups that we offer on a monthly basis, we've expanded them to be beyond just our actual, individuals living with COPD, but also their caregivers. So they can feel knowledgeable, they can feel empowered, and they can be involved in that decision making for their family members and for themselves.
Right. Thank you, Marissa, for highlighting the incredible resources and sense of community that the Loop provides for those managing COPD. It's inspiring to see how shared experiences and expert guidance can truly make a difference in people's lives. If you're looking for that kind of support, join the Loop today. Visit lunghealth.ca to become a part of this vibrant community and get the tools, resources, and connections that can help you live well with COPD. We'd like to thank our partners and sponsors GSK Canada, AstraZeneca Canada, and Trudell Healthcare Solutions for making tonight's event possible. Thank you for your continued support and work in COPD care for Canadians. I'd like to welcome our final guest this evening, Laura Tamlin-Watts, a passionate advocate for seniors and the CEO of Can Age, a national seniors advocacy organization with a background in law, policy development, and academia. Laura's dedication to improving elder care is matched only by her commitment to empowering seniors to live independently and with dignity. Tonight, she's joining us virtually to share her insights on supporting seniors with COPD and how families, caregivers, and communities can work together to enhance the quality of life for seniors navigating this challenging condition. Welcome, Laura.
Delighted to be here today.
Now, what are some key health and social services that families should be aware of to help seniors manage their COPD more effectively?
Home care is critically important for people with COPD. Some will need a lot of it, some will need just a little bit. But we need to make sure that home care workers know how to actually support a person properly with COPD. And that's not always a skill set everybody has. We know that there's not enough publicly funded home care, and it changes sometimes based on postal code, let alone in different provinces and territories. But I don't think there's anyone that's got it right. And so part of what that's going to mean is you're going to have to think about, what do you actually need? Advocate to get that publicly funded. You may want to start thinking about family and friends who could help to support you, or even looking at some privately funded healthcare so that you can age in place.
Excellent points, Laura. Moving on to care planning, because we know how important this is, how can caregivers and families work with healthcare providers to develop personalized care plans that respect seniors' independence while addressing their health needs?
Care providers need to be supported. We need a holistic wraparound way of planning for care. And that doesn't just mean that a person is a patient and then a person is a caregiver. That's not how we are anymore. That person with COPD may be a care provider for somebody else as well. They may be taking care of their spouse with another condition, or taking care of an adult child with a developmental disability. So when we're mapping a care plan, we need to start first with the life plan that they have. Who are the people in their neighborhood? And increasingly, many older adults don't have anyone. And that's a reality too. 75% of all care is provided for free by family and friends, except many times people don't know anything about COPD. They don't feel like they can support it because they haven't got training as caregivers. And increasingly, there may be nobody to provide that care.
Absolutely. Seniors deserve to feel empowered in their journey, totally. Speaking of which, what are the most effective ways to empower seniors to stay active and engaged despite their COPD diagnosis?
Like anything else, of course, health and well-being are easy to talk about and sometimes hard to do. But what we know is this: if there's a social connection with your health connection, people are more likely to do that walking club. They're more likely to do the exercise class. They're more likely to actively engage. So a cup of coffee or a bit of a network, those types of things promote health and well-being. We've got excellent evidence to suggest this. The other thing that helps is this: if you're going to be doing a kind of exercise class or offering up some type of community support, let people know that you know it's a COPD inclusive or an accessibility inclusive class, and that folks there will give you all kinds of different ranges of health. So if you're in a yoga class, that there will be different kinds of approaches offered in that class. Sometimes even just talking about lung health and COPD helps to get rid of the stigma and let people feel comforted that their disability, which is what it is, has been seen and accounted for as well.
How can caregivers help ensure that seniors with COPD have a safe and comfortable home that promotes their health and independence?
Everyone wants to age in place. What that looks like, of course, depends on how well set up the physical built environment, your house, your apartment, your cottage is for you to live there. There's lots of home modifications sometimes people can do that are easy. In my book, Let's Talk About Aging Parents, goes through them to find some quick and easy tips, like changing your dining room into an accessible bedroom and getting that hospital bed in there so people can lift themselves up, making sure that you've got good electrical plugs around the bed so you don't have any of these dangerous cables. But for some folks, they actually are going to need to move someplace closer. And so let's get a plan in place ahead of time for what folks would want to do before they need to do it.
Thank you, Laura, for sharing your expertise and insights with us tonight. Your work in advocating for seniors with COPD and improving their care is truly inspiring. We appreciate your dedication to creating better resources and support for this community. Thank you once again.
It's been a delight to be here today, and thank you for all the great work that you are doing. And we're excited at CanAge to continue to be a partner to support lung health and really raise awareness of COPD, making sure that people get the care and health that they need now and in the future.
You've heard a bit about our new person-centered network, The Loop. If you're seeking resources, support, or a community to guide you through a COPD diagnosis, or if you're a caregiver, The Loop is here for you. Register and join the community today to become a part of this supportive community. As we wrap up tonight's event, we want to extend a huge thank you to all of our incredible speakers for sharing their knowledge and insights on managing COPD, the importance of community support, and innovative tools like Aerobica and programs like Singwell and The Loop. You've heard how these resources can help individuals not only live better with COPD, but thrive through shared experiences, expert advice, and practical solutions. Remember, the Lung Health Foundation has a wealth of resources for you, including Fitness for Breath, My Lung Health Coach, and the upcoming Pulmonary Rehab Portal, tools designed to support your journey towards better lung health. Be sure to check out lunghealth.ca for more information on these programs and to learn how you can get involved in our advocacy efforts. A special thank you to all of you joining us tonight. We encourage you to stay connected with the Lung Health Foundation by following us on social media. Stay informed on our campaigns and take action, whether it's joining The Loop, advocating for COPD awareness, or making a donation to support the cause. We appreciate your involvement and time. Together, we can make a real difference in the lives of those living with lung conditions. Thank you, and we hope you stay healthy, connected, and empowered. Good night.